Good afternoon, everyone. I am Dr. Chirag Chamria, and today I would like to talk about the universe in your mouth. First, this is where I practice. This is our consulting room, this is our reception, and this talk wouldn't have been possible, our clinical practice wouldn't have been possible without our mentor, founder, and my father, Dr. Arun Chamria, who we lost last year. So in the physician's universe, the whole body and its ailments are present, but for us as dentists, it's only the mouth which is our universe. So in this talk, I would like to highlight only 5 cases. In these 5 cases are unique to me, unique to us. These 5 cases is where we used our technology to give better results to the patient. So first, a young female patient, 11-year-old, was referred to us with a minor swelling and dull pain on the left side of the jaw since 1 to 2 months. Our first reaction was, okay, it could just be a carious tooth, or it could be a tooth which is erupting and that is why the swelling was there. But the mother was very insistent. The mother was, no doc, you please have a look. Kuch to hai idhar. We went ahead, we did her x-rays. This is what a 2D image, the OPG, showed us. We could see a huge lesion on the left side of the jaw involving one of the third molars. The lesion was about 3 centimeters by 3 centimeters in size. This was just a 2D picture. We had to go ahead and do a 3D scan for the same. Having the machines in the clinical premises was easy for us, and hence this is the picture we got. So our diagnosis changed from a carious tooth or an erupting tooth to probably a cyst. So we went ahead to rule out any kind of a vascular lesion. We went ahead and did a FNAC. We could see a straw-colored fluid. A straw-colored fluid would mostly indicate fat cells, which means that the likely diagnosis was dentigerous cyst. Now over here, what was the challenge for us? The challenge over here was to preserve the facial nerve function as well as the facial symmetry. She's just an 11-year-old. We had 3 treatment options. 1, we could wait for about 6 months, let the cyst reduce in size, or we could just do an en bloc resection. But we selected to go with the third option, that is enucleation. The biggest risk in this particular case was the very thin inferior bone which was left, which could result in a pathological fracture during the treatment. We could preserve the facial nerve function, and we also were not able to breach into the inferior border. So over here, we could only see a 3 mm margin post-op, and this is what the miracle of a child healing is. In just 4 months, we could see completely normal anatomy and healing, and this was the cyst in toto. So finally, we got the final report as dentigerous cyst, which we were expecting, and we were happy with the results. This is the patient with no facial asymmetry, and the mother is happy too. Now let's go ahead to case number 2. A middle-aged female. She had a history of untreated gum diseases about 10 years back. At that time, when she was pregnant, she was conceiving her first child. She did complain of foul odor, bad breath, but at that time the priorities were different, and she could not visit the dentist at that point. This is her present situation. We can see the teeth are mobile, they are not in shape, causing low self-esteem, mobile teeth, bad odor. We went ahead and we did her x-rays. When we looked at her x-rays, a typical picture of completely worn off teeth. The bone is getting weak, the teeth are mobile, some infection here and there as well. We had 2 options here. Either remove all teeth, or can we save them? We chose, for a 45-year-old, we don't want to go ahead and extract a tooth. We would want to save them. And that is where the technology of using better kind of artificial teeth comes into play. SAP teeth or shock absorbable teeth, mainly the advantage for these kind of teeth were because they reduce the load on the bone. We were able to save her natural teeth, which were even shaking, and thereby giving her a more natural smile. So this is her intra-op picture, this is the framework, and finally, this is the result which we could achieve. We did place some implants wherever we could not restore the teeth. This is the final picture of the patient. Let's go ahead and look at the third case. He's a 63-year-old man with a reduced mouth opening, mobility. Actually, this case is quite funny. So, he had a history of tobacco habit. He stopped it about 15-20 years back. Now, one of his maternal side children were getting married. So his wife is like, if you need to attend a marriage, you have to get your teeth fixed. With this, you will not come to the marriage. So he came to us. We did look at the clinical picture. And during our finding, we looked at the tongue. We could see a white lesion on the tongue, which is typical of leukoplakia. But in front of that, we could see a very small hard mass. Induration was present. This raises suspicion. So we went ahead, we did a biopsy. Biopsy showed us a atypical squamous proliferation, which means it was not dysplastic, but it is still not normal. The patient just asked me two questions. One, how long do I have to live? I said, don't think of that. You still have long time. It is just dysplastic. We can simply just treat it. And second thing he said was, can I attend the marriage which is to be there in 7 days? Typically, we would not get an MRI done for this case, but because he wanted to understand the time frame for surgery, we went ahead and did an MRI. Because the lesion did not involve the second layer or the fat planes, we advised, okay, we can wait for 7 days. We went ahead. Now what happens in these kind of cases, if we are treating it in a hospital setup, we can't do the dental treatment because of the lack of equipments which are there. And if we do it in a clinical setup, we cannot look at the tongue lesion as well. So we went ahead, under the anesthetic care, we did a daycare procedure for him. And this is the typical result which we could get for the teeth. As well, we went ahead and we just did a superficial excision of the lesion. The depth of invasion was hardly 0.3 mm, so we could remove about 2 mm of the superficial layer, and the patient is healed. So this is the final result of the histopath report, where the margins were free of dysplasia. This is another case. It was quite a challenging case for two reasons. One, she had a history of angiosarcoma on the face. Basically, it is blood vessel related cancers. She was treated with chemotherapy and radiotherapy around 3 years back from today. And she complained of missing teeth, reduced mouth opening, and burning sensation around the mouth. The mouth opening was so less that even our mouth mirror, even our instruments could not go inside. So we had to do it under sedation. Over here, because our impression trace, so if you have visited a dentist, you would know that the dentist would always go ahead and take a measurement of your tooth. We could not do that in the traditional sense. Hence, we use these intraoral scanners. They are computers, they are cameras which can actually take a 3D scan of whatever area we are trying to get. So this is the biggest surgical challenge in this case, was the reduced mouth opening and limited surgical access. This was the typical, after the implants and everything were placed, we could not even take the photographs, and hence this is her upper tooth picture. These are the 3D scans which we used. This is the final picture. In this case, because of the reduced mouth opening, we had to go ahead and actually customize these screw or implants as well. In these kind of patients, she also had an adverse reaction to the COVID booster dose, so her whole face started to ulcerate as well. In these kind of patients, I feel it is not only the treatment, but also the aftercare which we have to manage. We have to take care of these patients. We have to talk to them. We have to make them understand, because the treatment is not going to happen in one day. Even after we give them teeth, it is going to take them at least 6 to 8 weeks for them to start eating regular food as well. This is one of the most interesting cases. This is one of my most favorite cases, and the last case for us. She's a 90-year-old female. She came with her son, and she just told me one thing, that every week on a Sunday, around 15 to 20 of us meet, and they all are eating on the table. I cannot eat. Can you do something for that? This was her x-rays, and this was her clinical picture. As a 90-year-old, we would think, क्यों करना है, it's okay, just leave it, you know. But when the patient just said this one line that I'm sitting with everyone, everyone is eating and I'm not able to eat, what would you do in such a case? She did not have enough bone for regular placement of implants. We cannot go ahead and do an extensive surgery on her considering her age. We took all precautions, we did her 2D echo, we got the physician consent, everything done, and then we planned to do the surgery. Now, what was the surgery here? In such a case, we do not go ahead and cut into the gums, but we use 3D printing. We use 3D printing technology wherein we pre-plan the surgery, we do a mock drill, we pre-plan the surgeries, and just during the surgical procedure, it is just a guide which helps us to place the implants. This is, the first picture shows the position of the implants in her mouth, and the second picture shows us the framework which is being placed. It is like building a building. First you lay the foundations, then you put the slab, and then finally it's the paintwork. These are these intraoral scans of the patient, and this is the designing of the patient. This is what we could achieve for her. After which, the patient only had one aim. She wanted to eat sev puri. This is what she told us. In the evening, once the treatment was done, we actually called for a sev puri for her, and she ate it, and that happiness is why we practice dentistry. These are the final results. Mind you, this picture is taken 4 months later. In between, she also got a brain stroke. She recovered from that. Still, she is healthier. I feel we do play a part in improving the quality of life of a patient. Technology and dentistry have grown so much in the past half a decade that I think using 3D scans, 3D printing, milling, all these have made now dentistry much more accessible, much more painless, and much more efficient. Thank you.
Thank you, sir. That was a really enlightening talk, and we all now agree that general practitioner plays a good role, but the dentist also play a good role in our day-to-day life, right? So thank you so much for this talk.
Thank you so much.
I now request our chairpersons, Dr. Sanjeev Maniyar sir and Dr. Himal Maniyar, to please felicitate our speaker, Dr. Chirag.
ये स्लाइड अच्छा था।